My name is Shonte Drakeford. I am currently 37, and at the age of 31, I was diagnosed with stage 4 metastatic breast cancer as my initial diagnosis. I am triple positive, meaning the receptors that the cancer grows from is from estrogen, progesterone, and the HER2. I also have a genetic trait for colon cancer, and I am a nurse by trade. I've been a nurse for about 15 years. I started as a nursing assistant, then moved to a registered nurse, and I worked mainly in the labor delivery realm. And now I am currently a nurse practitioner working in primary health care with the underserved community, especially in the African American community. I want to make sure that we as an African American community have a clear understanding of what clinical trials are, the benefits, the access, how we can get it, how we can obtain it, and just to the general public and big industry, pharmaceuticals, and everybody, just to kind of make people aware of how things could get better and how we can improve the African American community in clinical studies. A few disparities that I always like to touch on is that the word clinical trial, it's an intimidating word, a study. I think for anybody, now, no matter the race, that term, you kind of get intimidated and you're like, well, what does it mean? And what is it involved? And is it an experiment? And I want to help people understand that the language matter. If you present clinical trials in a way that has the proper language and almost like excitability to it, you can definitely recruit more individuals in the study instead of saying, oh, it's a study, it's a clinical trial, we're just gonna do this and do that. No, just say, hey, you want to be a part of this revolutionary study. It's going to be for the future. It's going to help the people behind you. It's going to help better the environment and everyone in society give better access. Don't you want to be a part of that? Because the things that you take now, someone was a part of it. There's a huge digital divide that people don't talk about. When I say digital divide, I mean that there is a lack of access to technology. Every household doesn't have a computer. Every household doesn't have a phone. And if they do have a phone, they may not have the bandwidth in that area to even, access these clinical databases that are so not user-friendly, first of all. And then you access the clinical database and you're like, I don't know where to go from here. There isn't a step-by-step help button for this. And then some people have government issue phones, and I hear that isn't spoken about a lot. If you are lucky to get offered, which I think I'm one of those people who were lucky to get offered clinical trials, they push you with all this paperwork. It's thick, it's not easy to read, the jargon is confusing, and they just like sign here, sign here, sign here, but you don't have a clear understanding on what's happening. We need navigators and educators to help us get through this paperwork. Another disparity that I always wanted to mention is the trips, the constant check-ins. With clinical trials, we have to check in, report this, come into the hospital 3, 4, 5 times, and people have livelihoods. Transportation could be a concern. Are you going to provide us transportation support? Are you going to provide us child support? Are you going to provide us financial support? Because now I have to miss work to come here because there isn't any after hours that's offered for clinical trials. And if we don't make this accessible, these disparities is going to get worse and worse and worse. And I think we don't emphasize the value of clinical trials. I mentioned it earlier that it's revolutionary, it's futuristic. It is something that's going to keep us living. So it's very vital to be involved in this. Another benefit is that you get access to the earliest form of drugs. For instance, with me, when I first started my cancer treatment, the drug was just FDA approved, probably like a month before me. So now the standard of practice is going to change, and my doctor took a risk and said, hey, I want to start you on this new drug regimen. And because he did that and didn't take the traditional route, this drug has provided me better quality of care because I could take it orally. And we know a lot of clinical trials don't offer a lot of oral chemotherapy type treatments. The standard in the statistics said it would stop working in 3 years. I've been on it for 6 years, so I've surpassed what the clinical studies have studied and said it will happen. I was young when I was diagnosed with breast cancer, and I was exhibiting symptoms since I was 25 years old. And me being a healthcare professional, although I was very young in the field, I just felt like I was even still blindsided by the fact that I was ignored, I was denied, and I was delayed the proper diagnosis to get the treatment that I needed. I ended up with stage 4 metastatic breast cancer. No matter how hard I tried to get that early detection. I was delayed for 6 years. I might not be able to run as fast anymore. I may not be able to walk as fast anymore. My pain may increase. I may, be more nauseous and things, but I take those days in stride and say, hey, I have a day. It's just me, the medicine is working. And then on my good days, I got good days. I'm hanging with my friends. I'm not thinking about cancer. I'm going on vacation. I have a farm. I got a boater's license. I don't have a boat, but why not? You know what I mean? If anything, just kind of help boost my zest for life. And because this is terminal, I can't control it, but I definitely can advocate and use my voice to help expand the treatments available, if not for me, for the young women who are behind me, young men who are behind me, young African-American women who are behind me, everybody. But I'm gonna do this literally until I die. But I just want everyone to, value your days, spend that time with your family, go on those vacations. What are you waiting for? We all know, especially with cancer, there's no planning. You can't plan anything, but you could plan a little bit and just adjust yourself, reinvent yourself. If you can't work, try to find another hobby. I volunteer as a camp nurse because I love nursing so much. So I volunteer my time whenever I can. And I read and I play video games. I mean, I enjoy my life, honestly.